Until the pandemic came and hit us, I think a lot of people were not quite so aware as to how much our lives are impacted by global events that might start anywhere.
This is a real crisis.
I mean, it's been clear that this was likely to spread in the U.S.
We need to be thinking much more ambitiously.
Climate finance is a very big issue.
We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
CGD came about because it was time to focus not only on what developing countries should do, but much more on what the rich world should do.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
Some of our previous work has helped to come up with a kind of innovative financing mechanism that was used to help launch pneumococcal vaccines. We really have researchers and experts here at CGD who come at these issues from multiple vantage points, and I think that's just what helps make our research more rigorous, more rich, and actually more connected to the realities that decision makers are grappling with.
We've been looking to CGD for all of your research and analysis to guide us.
So CGD is nonpartisan. Because of that, over the years, that credibility has given us significant convening power.
Our government highly values the work.
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
Every single time that we're able to get it right, it means we're reducing significant poverty.
If you can help to make things a little bit better, that's a good way to spend your time.
Hello, everyone, and welcome to our session on care data portals. I am Nirja Penamecha, the Associate Director of Programs and Operations at Data2X. Data2X is a civil society organization working to improve the quality, availability, and use of gender data. This event has been organized by the Women's Economic Empowerment Measurement Learning Collaborative. The collaborative is a joint initiative of the Center for Global Development and Data2X. Together, we can convene we experts from across sectors to advance the understanding and informed use of we-related measures for research and action. We invite you to learn more about the collaborative and our work online at Data2X and CGD websites. For today's session, we'll begin with a few remarks from our moderator, Myra Buvanich. Myra is a Senior Fellow Emeritus at CGD and a Senior Fellow at Data2X. She's an internationally recognized expert on gender and development and social development. Following Myra, Marissa Miodowski will present a city-level data portal initiative. Marissa is a senior advisor at the Buenos Aires City Statistics and Census Office. She is a gender policy and data expert and has substantial experience working with both international organizations and local governments. Then we'll hear about a global-level data portal from Laura Adati and Jerome Dehenu. Laura is the Senior Care Policy Specialist at the International Labor Organization, where she works on gender equality, promoting women's economic empowerment, as well as the ILO's research on care work, maternity protection, and work-family policies. Jerome is a senior lecturer in economics at the Open University. His research interests include economics of gender, labor and household economics, and fiscal and social policy. Following the presentations, Myra will moderate a Q&A session. Please use hashtag CGDTalks at CGDev to submit questions. And with that, I will turn it over to Myra.
Hello, everybody, and thanks so much, Niraja. And there's somebody banging next door. I'm in Santiago, Chile right now, so if you hear bangs, unfortunately, I won't be able to do anything about it. But anyway, welcome everybody again. And as Masood in the video, if you watched it, said that the pandemic really sort of struck a chord as to how much the rich countries matter for global development and for the developing countries. The pandemic also, I think, highlighted for the first time in very clear terms the importance of care. I mean, as care services were closed, schools were closed, care, and particularly unpaid care, became a big issue. And for the first time, I think everybody realized the important contributions that women have been making to through unpaid care throughout the centuries, I would say, and particularly in developing countries where care services are not fully developed. So the next issue, and I think that this is an issue that CGD and Data2X are very much working on and prioritizing, is how do you measure care? We do need desperately to tell the world, how much time care services demand, from whom, and what are the returns to care services. And here we have, and I'm delighted to introduce, we have just two efforts that are really, one is very local and the other one is global, on care initiatives and care data portals. So the city of Buenos Aires is very well known for always being very innovative. I remember it from years ago. I don't know if you all know, but the city of Buenos Aires really has been sort of spearheading women's initiatives for a very long time, women's leadership initiatives in particular. So I think sort of reflecting how much ahead of its time the city of Buenos Aires is, the city of Buenos Aires has in fact put together a portal, a data portal on care-related services. And I'm delighted to turn it over now to Melissa, who will tell us all about the portal. Thank you so much.
Well, thank you very much, Mayra, and good morning, everybody. It is really a pleasure and a honor to be here this morning with you today, sharing our care data portal, our indicators care portal. This has been a collective effort, I have to say, and it took place during the pandemic. During the pandemic, we, as a statistic bureau, had the time to concentrate on how to organize all this data that we have been collecting for a while and produce this system that allows, as Mayra was saying, to show how care is provided, but also how care is organized at the city level. I would like to start by sharing the system with, and later I will explain how we develop it and how are we moving forward with this data into policy making. So if I can share my screen, see if I can do this. Oops. I would like to share first my screen with the portal, if I can, so people can have an idea about what I am talking about. Let me see if it works, because we practiced this and now it seems it's not working very well. Sorry for this. Do we have a chat where I can paste it in? Typing the web page there so people can see it. I'm sorry for technical problem. Well, in any case, I will start by telling you that this the whole effort that we put together took us a year. That's a link. Yes, that's a link. And as I said before, it was a collaborative effort. It was implemented not only by public civil servants like me and my team, but also in collaboration with non-governmental actors. people from the academia, activists, and researchers who have been working with the care agenda for a while in the city of Buenos Aires and in Argentina, and also internationally, have contributed to this effort. I'm not sure if you're seeing the system or not. It seems that it's not. So let's go to the presentation so people do not get bored, and I can later share by email or in the way that you choose the system, so you have an idea about what it's about. So I have organized the presentation. Let's move to the next slide. In 3 pages. First, I'd like to talk about the conceptual framework for the care indicator system. Then I will talk about how we build the building and setup process, and also the way that we are moving forward. So if we can go to the next one. Before measuring care, we have to make a definition about what care is about. I see something that my audio is not, are you not listening to me well?
The audio is not terrific, but you should just continue, Marisa. They'll try to fix it.
Okay, so the definition for care that we picked in order to find the data and build the indicators was a simple definition of care. We define care as the tasks that satisfy physical and affective needs that allow the reproduction of people's lives. It could sound simple, but it covers a lot of things. But we wanted to left out some health-related issues that we were not covering with this system. And we left out some other services and activities that are happening and mainly provided by the government, where we have a lot of data. Just to give you an example for homeless people, because we didn't thought that this was comprehended in our definition of care. And the other conceptual definition that we have is that we wanted to organize care within the diamond of care. This Ravazzi definition that has been adopted by many academicians and by many policymakers and international organizations. We can go to the next slide. So the system was organized according to these two conceptual ideas, but also within two other very important axes that we consider here like an economic model. We wanted to measure how the demand of services, of care services was organized, and also how the supply. And in the demand, we make two subdivisions: the effective demand of care services and the potential demand. Because this idea of potential demand, how much care the city will need in the future, would allow you to use it for policy making, to calculate how much services, how much amount of care, how much this will cost. So with these two we started to build the indicators, and we focused on 3 populations that demand care: children and adolescents, older people, and population with disabilities. And on the other hand, on the supply side, we focused on the 4 actors of the diamond of care: the public sector, the household, the private sector, and the community-based organizations. If we can move to the next one, please. As we wanted to measure all this with data, we needed some operational definitions about who this population is. So, as you can see in the slide, for children and adolescents, we considered all people younger than 18 years old, but we separate them into 3 main groups because it is not the same amount of care needed for caring for children in the early childhood than for adolescents. For older people, we consider all people from 65 and older, but that means being older does not mean that you need care. So we wanted to specify that in order to put the information into indicators. And again, for population with disabilities, we consider people with physical and mental disabilities that needed some support to enjoy a full life. So that have some sort of this. If we come to the next one, please. Here are the actors that provide the care, as I mentioned before, households that, as we will see with the data, are the main providers of care. Despite, as Mayra said, the city of Buenos Aires is a very innovative city and we have like a very large provision of care services, still the majority of care is a responsibility of the public sector, the private sector, and the community-based organization. And for all these actors, we needed to find the data in order to show how much care they were providing. If we can go to the next one, please. As we wanted to understand and ask questions about how care is organized in the city, we needed to cross this information by two main variables. On the one hand, gender. And for that purpose, we use as much as we could all the information disaggregated by sex, because this is the main variable to us to understand the gender relationship in the provision of care and also in the need of care, as we will see later. And secondly, we organize the information by geographic location. And why is that? Because in the city, there is a very strong correlation between the location and the income level of households. Most of those located in the southern part of the city belong to the lower quintile of income, and those in the center and in the northern part of the city are located in the upper part of the scale. If we can move to the next one. So once we have this all conceptual framework ready, we went to see where the data was. So the first thing that we did was to find in our own data bank. And we used mainly our own surveys. The city of Buenos Aires have been conducted surveys for a very long time, and we are lucky enough to have a lot of information and with a interesting period. Most of the information comes from our annual household survey, that is a continuous survey. Then we have a specific chapter that measures disabilities, and this is from 2018 and is conducted every 5 years. Our time use survey, we are the only city in Argentina that conducts a time use survey. We have done this twice, once in 2016, and next year we have planned to conduct the next round. We also use some work that we did in preparation for the census, the national census that took place this year. And we also use some population projections in order to measure the future unexpected demand. And as a secondary sources of information, we use a lot of administrative records, data produced by the services delivers inside the administration, and also from some services provided by community organizations. And at the same time, we use data coming from the national government when we were able to find it. And we took advantage of the open data portal that the city has that gathers a lot of administrative records that were not in our data banks. So we did an alliance there. So these sources of information determined the periodicity of the data showed in our portal. If we can move to the next one, please. So, and I'm happy that I prepared this for you because as we cannot see the portal, these are some of the key findings that the basic key findings that we can find in our care indicator system. Just to show you some examples. When we see the projections and the current demographic composition of the population in the city, we see that Buenos Aires is becoming an age city, and it's moving along the patterns of any European country. And at the same time, that women are more than men, particularly in the upper side of the pyramid. Right now, this is a picture of 2022. We have 236 women older than per 100 men. And these women, we see crossing with other data that are in a high demand of care because they own and they have higher dependency rates. If we can move to the next one, please. At the same time, we have some projections to see how the population will grow. We know now that it's age. And we also know, based on these projections, that it will not grow a lot. There will be a very slow growth rate, and this growth rate will happen particularly in the southern part of the city. And this also gives an indication of what sort of care services we will be needing, and also where these services will be. If we can move to the next one. At the same time, as I mentioned, we measure the supply side, how much services are being provided. I picked this indicator that is the number of care centers for children aged 0 to 3 years old. And as we can see here, this the number of centers has not grown significantly. And the majority of them are located in the north and center part of the city, while the majority of young people are in the southern part. So here we see a disconnection between where the offer of services is and where the need of services are. So this is just to give you an idea about the sort of information that the portal provides you. If we can move to the next one, please. Another example is the distribution of people with disabilities. When on average, we see that people who have some sort of disabilities are evenly distributed along the territory. But when we do a zoom in the population older than 80, where disabilities are higher, we see that there is a gender gap, and women have more disabilities than men, and that women are located in the north and center part of the city. And then when we focus on where the services for these people are, again, we see a disconnection between the level of the services and the demand of the services. If we can move to the next one. We also see here what sort of dependence these women and population in general have. And again, we observe a gender gap. women face much more difficulties in enjoying a good life. They face difficulties particularly for mobility purposes and also in their daily activities. And all this information is coming from the, as I mentioned, from the disabilities module that we included in our annual household survey. So we can cross that with many other variables that the system shows. I know that I'm running out of time, so I will go a little bit faster. If we can move to the next one, please. This is another indicator that I wanted to show you. The average time that households allocate for caring for people with disability is around 4 hours. But when we disaggregate that by sex, we see that women care 1 hour more per day. If we then make a projection for a year, the gap difference is huge. So the system is showing us that there are a lot of gender inequalities in how care is organized. And also, if we can, when we cross this information by geographic location, we see that in the southern part of the city, where, as I mentioned, most of the poor people live, households do not receive any sort of support for caring for people with disabilities. While in the northern part of the city and in the center part, they do receive some sort of support. If we can move to the next one. So these are, as I show you, some of the indicators that allow policymakers in particular, but any person living in the country with not a lot of data literacy. The system is very friendly. Every data can be downloadable and reuse it. Every indicator has a graph associated to it. So we believe that it's very easy to understand and to see the organization of care and also the gaps for this organization. So these are some examples of questions that the system allow us to post to ask. So far we have 74 indicators in the system. The majority of them are related to government provision of services, and those coming from the time use survey are related to how a household allocate the time for caring purposes. But we are building new information. Our idea is to have more information from community-based organizations, and also we are currently delving on the characteristics of those who work at public organizations as care providers, to see who they are, how have they been trained, and how much are they how much are they working. So if we can move to the next one. Just to tell you briefly, we built this system, as I mentioned, with a lot of external expertise. We were lucky enough to have very good sponsors. The Open Data Charter provide us with some funding that allow us to hire consultancy work from Maria de los Ángeles Duran. She's an expert. She has been studying care, the care economy for many years, and she guided us on how to select the indicators, on how to refine the definition of care, and also she's currently also supporting us in the way forward on how to continue building the evidence. And also we got some funding from the United Nations Population Fund, and with their funding we were able to hire another expert. She's from Uruguay, and her name is Valentina Perrota, and she also helped us in refining the indicators, particularly focused on older people. And I want to stress this because all that training has been very useful for us as public servants to continue working, to continue thinking, to continue producing information that that will remain as a value as a public value for everyone who wants to use it. We also made some consultations with activists, with researchers, for them to guide us on which sort of data was needed for other purposes, for doing academic work, and also for lobbying for new regulations, as it's happening right now in the country, where the Congress is about to debate a new law for an integral care system. And if we can move to the final one. In our conversation with some policy makers, inside the government, we were showcasing our product and trying to think with them about how to improve the care provision. We had some good receptiveness. We are currently working with 2 agencies inside the government for producing more data. Why? Because the care indicator system provides us with an overview of the organization of care. But sometimes for making more accurate decisions, you need more specific data. And this is the case for services for older people, public and private services. We are currently working with an agency that deals with this in the city, and we are running a census of all these organizations in order to understand better who is receiving the care and who is providing the care in all these centers. That there are a lot in the city, and there will be more as the population projections are showing. And at the same time, we are working with a consortium of organizations that provide services for disabled people who are, on the one hand, organized by the government, but the services are provided by community-based organizations. And with them, we cannot run a census, but we are conducting a survey, volunteer, but so far our responsiveness rate is very, very, very good. So this is just to show you how we are moving forward in order to build more evidence, but as a demand, a request for people who will be using the data for policy making. Yes, I'm done.
You're done, I know. Thank you so much. And I was just going to make the comment. So how are you using this data portal? But it's wonderful to see that you are already doing that. I just want to, before we turn to the next presentation, I just want to stress sort of the really neat way that you people have done the data portal, sort of building the conceptual framework, the operational definitions, looking not only at childcare, but elder care and all people with disabilities, the importance of administrative data and how you have used the administrative data and how you have been able really to not only look on the supply side, not only at public services, but community organizations that provide services. So I think it really, it's an amazing system, data portal, and I think it can be used by other cities in many other places of the world, because we're all facing the same thing. Anyway, we can take questions later on, but I am now delighted to turn this over to Laura Dati from the ILO and Jerome. And, I just want to say how, again, if the city of Buenos Aires has been sort of advancing and really ahead of the times and looking at gender issues in, the same with the ILO. I think that the ILO really has had incredible, advances in measuring women's labor force participation and in looking at the informal sector. So, and here now we have this new work of the ILO, and it's all yours, Laura and Jerome. Thank you. You need to turn on your mic, Laura.
It's yeah. Can you hear me now?
Now we can hear you. Thank you.
Thank you, Myra. It's really a pleasure to be here today with Jerome, and we really thank CGD and Data2X for organizing this. It's a pleasure sitting also close to the city of Buenos Aires, this amazing experience that we really hope, as you wished, Myra, could be replicated by many other cities all over the world. And so here we are with this global experience that it has been possible thanks to the support of the Bill and Melinda Gates Foundation, is part of a global commitment to care data that the ILO has undertaken as part of the our constituents, governments, workers, and employers organization commitment to the investing in the care economy. And here we are putting together our efforts to provide evidence and support to countries, practitioners with this new data portal and care policy investment simulator. The idea here is really to assist on showing how we can close care policy gaps through investment that are country-specific, gender transformative, and what are also the benefits of this investment. So today I will focus on why we built this tool, what are the key features, the results, how they were obtained, and Jerome has been collaborating with us on this and discuss about this and how we can use these results. So last March, the ILO published a global report, Care at Work, that covers, reviews the progress and the status on care policies around the world, on legislation concerning care leave policies. For the first time also we survey care services, childcare and long-term care services for over 180 80 countries, using international labor standards as benchmarks. Let's remember their convention and recommendation agreed by governments, workers, and employers, and try to give guidance on how to promote decent work and gender equality. The report shows that there has been some progress with maternity leave policies, for instance, that match better the provision of ILO standards. More countries are offering paternity leave. Also, we could survey also the situation in terms of childcare services. So despite some progress, however, we found that there are persisting and significant legal gaps, and they just give a sense of what are the huge gaps in practice and how people around the world are being affected by the lack of comprehensive packages. So for instance, we found that only 21 countries around the world mandate a universal right to childcare services. Still, 120 countries are without any statutory, publicly organized early childhood education development programs. And also when we look also innovatively for the first time for so many countries to how leave policies and childcare services are connected, we found a global childcare policy gap. Is what we call, it's this time lag between the end of leave entitlements for households and the statutory age at which childcare services or preschool services are available. And we find that this global childcare policy gap amounts to an average of 4.2 years, and in 91 countries out of 175 for which we have data, this childcare gap exceeds 5 years, and this affects over 2 billion potential parents around the world. So this is the time where parents have no option but to resort to unpaid care work or underpaid domestic workers or other suboptimal care solutions that really play a key role in cementing gender inequality over the life cycle and then impact the well-being of individuals, families, societies, and businesses. So we also looked for the first time building some data from our ILO statistics microdata repository to give some sense of what also the situation of childcare jobs, and we point to the also the undervaluation of these jobs when we compare the average hourly wages of ECED teachers. We found that this really represents a fraction of the wage of primary school teachers, and you can see this varies from 21% of in Sri Lanka, so to 57% of in the United Kingdom. So this is really widespread, and this is linked to the low value and recognition attributed to this profession, high level of feminization, low skilled, low unionization, and really dire working conditions that, as we know, it has been impacted by the pandemic and has brought the workforce in this sector really to a breaking point. So all these elements really point to the need of accelerating process and invest in transformative and nationally designed care policy packages. There should be country-specific, pursue a life cycle approach, and include a combination of leave policies, childcare services, and other services rights. So they have to be rights-based and also come with income security. There should be also universal, funded by solidarity mechanism and based on representation and social dialogue. So to really build the case for investment in these transformative packages, with Jerome, we have built together a macro simulation looking at, for the first time, I mean, the most extensive macro simulation covering 82 countries, which represent 87% of the world's employed population and 94% of world GDP, to show that there is a strong employment and gender equality investment case to really focus on integrated care policy packages. This can generate up to almost 300 million jobs by 2035, of which 96 million would be direct job in childcare. And if we look, so this slide presents the investment requirements by policy, and if we will want to look, for instance, at the case of childcare services, it will require about 1.5% of GDP for universal childcare of high quality, over and above the current spending of 0.3% of GDP. These investments have the potential also to be gender transformative, as the majority of jobs would go to women, they will be formal, and they play a key role in reducing inequalities in employment and also in earnings, so impacting also positively on the gender pay gap. Finally, with also working closely with Jerome, we also can show a strong return on investment on this investment, and Jerome will talk more about that from the methodological viewpoint. Let me just now show give you a preview of the simulator that will be launched later this year. As you can see from this slide, the simulator will be grounded on this macro simulation methodology that I've just presented, will cover 82 countries of those we are already working on expanding to other underrepresented regions. So cover the 4 policy, parental leave, breastfeeding breaks, childcare, long-term care services, and will provide 2 projection year for the macro simulation and allow user to extract results and compare countries. So the policies, the simulator really works in 2 parts. The first allows the user to build, let's say, specific, country-specific macro simulation selecting for specific parameters, and then run the results on jobs. So what are the investment needed, the jobs created, and other results. So this slide presents a preview of the first part. So as you can see, the user will be able to select one or more country, the projection year, and then go to specific policies, or all the 4 of them, select some specific parameters. For instance, for early childhood care and education, the user scenario will be built by selecting, for instance, the percentage of children that would like to be covered with different options, as you can see from the slide. How many hours the service will run, the pay level, the composition of the workforce, for instance, the share of educators over other staff, etc. And where possible, where data are available, also to compare the user scenario with what we call the benchmark scenario. So it's the data that we collected from, let's say, 2019, to have a comparator. Second part here's the preview. The results will be shown by few key results that you will see in the upper banner. This will include them. Investment requirement, the job generated, the ROI by each country, and the reduction in gender gaps. Then specific results can be obtained by the total of policy or by each specific policy. I have zoomed here the results for early childhood care and education. The user scenario will basically show the baseline spending, so the starting point, because this is also important to see where countries are starting in terms of commitment on early childhood spending and primary and secondary school education. So as a comparator, because let's remember, it's important also to think about how to build the fiscal space for those investments. And then other results will include the investment requirements measured with national currency, US dollar, and share of GDP. Then the section on about the job generated, that will be divided by direct jobs, jobs that go to women, formal jobs, and which the share of formal job that will also go to women. And then the final part, the employment rate, how this will change from the baseline and user scenario. And finally, for each country also, we will provide the ROI. So for each dollar, so for this, for instance, for this specific case, fictitious country, for $1 invested in leave and policies, there will be an increase of 3.549% of GDP, resulting for improvements in maternal employment and earnings. So I'm stopping here. I'm giving the floor to Jerome to tell us more about how these results were obtained.
Hi, everyone. Thank you, Laura, for a very, very neat and complete presentation of the tool. I'm just going to focus on the three main results that Laura was alluding to. It's the employment creation, the gender wage gap, the effect on the gender wage gap, and the return on investment, because they are defined in ways that are worth explaining a bit more. So the employment creation, we looked at the direct employment created. That Laura was referring to. It's the investment in care. So it's all the staff that we hire as a system to provide the care. So that's the direct employment. But also there will be more employment than that, because the care industry will require equipment, electricity, and other supplying items that will increase the employment in those industries, which is called the indirect employment. And a third type of employment, which is called the induced employment, is the general macroeconomic sense of when the economy grows because there are more jobs or an investment in a particular sector. The people who are hired earn more income, and some of that income will be spent on the economy, which will increase employment in the sectors where households spend their income or part of their income. And that's the induced employment. And we can use the tool that we have done for the 82 countries, is an input-output analysis of those connections between the industries and where do households spend their money, and how much of the income they earn will be spent, because obviously the rest would be taxed or saved, in order to derive those different types of employment. And then we can look at the proportion of women in each of these sectors and the proportion of jobs that are formal, based on current divisions of formal and gender in each of the sectors. So that's how we are able to simulate those aspects of employment. And then the next indicator, the gender wage gap. Laura, if you can move to a measure of gender gap in monthly earnings. So not the hourly pay, but the monthly earnings based on average wages for men and women. So we can compare what the current gap is to what the effect would be after an investment in care. And there are two types of effect. There's an effect of enabling mothers especially are the ones who have the highest child penalty from a lack of adequate parental leave or childcare services. So if there is access to universal childcare and adequately paid leave that are job protected, we can simulate the effect that it could have on maternal earnings. So on the supply side, we expect their employment to be maintained prior to their level before the first birth. The same for earnings. They would regain some of the earnings that they had. And to certain proportions, typically 80% of fathers, based on the levels obtained in countries with significant provision for childcare. And that will reduce the gender wage gap, because obviously, on average, women's earnings will increase thanks to the increase in maternal earnings. And then there's another effect that adds to this, because there will be a huge employment creation in particular sectors, mostly the care sector, depending on the wage level at which those care workers are paid. And the proportion of men and women who are taking up those jobs, it will also have an effect on average male earnings and average female earnings. And we can recalculate the gender wage gap based on that. Depending on whether the care wages are above or below the average wage, it will increase or decrease the gender wage gap. But then the combination of the two can be shown as the result that is presented in the tool. And for pretty much all the countries, the strong effect is on maternal earnings that dominates, which reduces the gender wage gap. in some countries quite significantly. So these are simulations. It's not empirical because it's obviously projections and policies that don't exist. So we estimate what could be the effect on employment and gender. And the same for the third indicator, which is the return on investment, which is basically calculated the benefits that we just talked about in terms of regained earnings and employment for mothers. So this is a return on investment specifically calculated for the effect of childcare and leave policies. On a narrow sense of the benefits, because obviously the benefits of better policies, such as in universal childcare, are also very much about the child well-being, child development, future earnings of children, etc. Here it's just calculated on the effect, that the more immediate effect of the lifetime earnings of mothers, because they can regain their employment. And if we assume that they can increase their earnings and their employment, so that on average all mothers earn about 80% of what fathers earn, which is a conservative estimate, but based on a study done for Denmark, then the increase in earnings it's a proxy for the increase in GDP, because earnings, labor income is a component of gross domestic product. So that's the numerator of the equation. And then on the cost side, it's the total cost of providing for the children of those mothers. So the years of parental leave and childcare. So if she has two children, then it would be the total years for each of those two children to calculate the total cost over, say, 8 years, for example, if there are 4 years for children of childcare, of providing that. So the kind of public funding cost of that. And you can determine the ratio between the two would be the return on investment. And just to explain a little bit better on how those benefits, the maternal earnings regain. If we take the next slide, we can see the just a schematic way of understanding this regained earnings. So you've got the father's earnings that are typically don't change over the lifetime after the birth of the first child, whereas for mother there is a large dip, especially in the early years, and then they regain some earnings but not much. So that's the orange and the blue area. And if we have good policy, we expect them to regain and have a more continuous pattern of employment, which would be just the orange area, so about 80% father's earning, which is the empirical evidence shown for countries with universal childcare. So that's the kind of the regained earnings is the amount of earnings over their lifetime until retirement. That blue area is what constitutes the numerator of the return on investment. So that's a simple calculation that can be done for all the countries that we have in the portal. And I return to Laura for concluding the discussion. Thank you.
Thank you so much, Jerome. And just in conclusion, we would like to mention that as the tool that Marisa's presented, also the advantage of this very expansive database is that really user can get the results. So use this tool as a powerful advocacy for evidence-based advocacy to support efforts to promote the adoption of this policy. So work with governments and other stakeholders to place investment in care top in national agenda and push really for concrete action. And this by showing not only the investment requirements but also what are the impacts and the benefits of these investments. So all this enormous database is built over 180 legal and statistical indicators obtained from multiple sources. So it's an easy tool for those who need really the evidence to take action and to advocate for changes. And here I'm showing some of the application that we have done since we've started the piloting. We also work in collaboration with the International Trade Union Confederation, the European Commission. We also the ESCAP for application in Asia, and we have also so now we're developing regional reports that also using the results of the simulation aim to put really the focus on regional and also national agendas. We have some work also going on in specific countries. So we really invite, and to also answer one of the questions, really we expect that practitioner can gather this data and for their efforts, for the advocacy efforts individually or jointly with the ILO. And also this is a topic that is gaining momentum also at international level with a lot of partners, the UN system. So we really count on you on using this tool. Stay tuned for its launching at the end of the year, and in the meantime we look forward to your questions and ready to offer assistance. Over to you, Myra. Thank you.
Thank you so much, Laura and Jerome. I mean, it's amazingly, what you showed is just very neat, and how transformative if policymakers really used the tool and derived policies as a result of the tool. I mean, it could be really completely transformative in terms of the labor market and women's opportunities. So the first question that I have for you, and that comes from my colleague Megan O'Donnell, is how can you use the data that the tool generates to convince policymakers who are not already convinced of the value of care? And has the ILO worked to reach particularly those in the ministries of finance that really sort of control the purse strings, and and for whom, if they really looked at this data, it should make a real difference? Laura or Jerome, you want to answer that?
Yes, thanks. Yeah, absolutely. That's really the what we have in mind when the simulator data will be available. It will become really public good in the hands of activist practitioners, as I mentioned, governments, workers, and employers. The way it's designed is really very intuitive, and results can be downloaded, and different policy scenarios can also be built really to adjust to different context and reality. And we really plan to work together to other partners, to partners around the world, also with CGD, really to reach the decision makers, those that really keep, have influence and power to change. It's a difficult conjuncture, but I think the power of this tool, thanks also to what Jerome has just presented, is that it's an investment. So that's really the big message. It's worthwhile because the pandemic has showed that we really need transformative measures, and it's possible. It's possible working together, replicating these efforts to take action. Thanks.
Great, thank you. I'm sure that CGD will be very interested, and Data2X, in working with you to disseminate this and to really try to convince policymakers. I mean, that's really the challenge ahead, and there's going to be a lot of advocacy, I suppose, that we need to do. If we turn to Melissa, and I have actually a question from my colleague Karen Grown, how much is the cost of the portal? Do you have any estimates?
It is a really good question because cost has been minimum in the sense that we did all the work in-house. The conceptual framework, as I mentioned, was built together with some international expertise that we were able to hire based in this donors collaboration that in the end were some days of work. It was not a huge amount of money at all. And then it has been our own time. We are public servants. We have been paid with our own salaries. And also all the development, all the programming of the portal was done in-house. Everything is in open format, so it can be replicated. It has its particularities because all the code goes to our own data banks, but we are very open to share the process on how we build it. Something that I did not mention is that we have some sort of trajectory in building this sort of portals. Our former experience was the gender indicator system that is also available online and has been not copied, but inspiring other cities and countries to go in the same direction. And we have been able to provide this sort of guidance for them, and we will be happy to share this case expertise. And so we were lucky that we were collecting and producing data for a while. So any city that has some data, even coming from surveys, censuses, or administrative records, can do the same thing as we did.
Great, thank you. My colleague Megan O'Donnell for CGD has a question for you, Marisa, that I think I'm going to sort of make it broader for both of you, but she was asking sort of if you want to give it to other city national level policymakers to look at developing a similar portal, what would be the challenges and what would you tell them to do or not to do? I want to broaden a bit that question and ask both of you sort of particularly, what are the data limitations that one needs to confront when doing these things, and what is the point, and particularly thinking of low-income countries, countries sometimes, in Africa and Asia that don't have the richness of time use survey data or, wage data. What do we do then, and how much you can continue to try to build these portals with less data, or what kind of data is fundamental for using this portal? And let me just start first maybe with Laura and Jerome, and then go back to you, Marisa.
I can say something about the data. Actually, it's interesting because yes, we had very many difficulties with finding harmonious data for all the countries, but we were able to derive some imputation or plausible assumption. But one thing important is that it's not necessarily that the lower income countries had fewer data sources. Some had very good data and complete data on all the issues that we needed, and other higher income countries in Europe, for example, despite having Eurostat and a huge database that's harmonized, also had limited data on some particular, like wage data, for example, wasn't available for all the countries by the presence of children, interestingly, despite that data existing. So there are also limitation about what's made public compared to what's being collected. So a huge call for the world is to provide more data, or if they have the data, to make it available for use in research. But then I agree indeed that there are more countries in low income and low to middle income countries we couldn't include. That's why we only have 82 countries, because we couldn't find relevant data on some of the main parameters. But imputation, especially the more countries you have, the more you could understand patterns and then make plausible assumptions on some of the aspects that don't that don't make you exclude the whole country just because there's one variable missing. So that's important, depending on the goal that you want to achieve.
Great.
So.
Laura, you want to add something? Or?
I will build on what Jerome just said, that it depends on the goal that you have with the data. And and thanks for the question, because Megan was asking about challenges and you were asking about data challenges. And probably the main challenge is the data and the quality of the data. But my advice would be to start with what you have and try to see if the data that you have contributes to asking the questions that you are asking, like the goal that you are pursuing by building this sort of data portals. Sometimes cities do not have timely surveys or do not have any survey at all, but most of cities have some sort of administrative records. And though these records are not always complete, and it has been the case also for an innovative city as the city of Buenos Aires, we started with something. We started with data from this year, and we worked together with the ministries in order to clean that data, in order to make that data more accurate, more rigorous, and we set a precedence. So for next year, these ministries will be collecting data in a better way, and they will feed our data care portal. And in this way, you make the whole system more robust. But while doing that, you also help policymakers to realize about what they are doing, what sort of services that they are providing. They start to think about what data is showing to them, and suddenly some changes are starting to happen.
Maybe
The
just to
beauty.
add,
Go ahead.
sorry.
Go ahead, Laura.
Yeah, just to add to what has been mentioned about the what has made possible also this huge efforts is also the what we have from the ILO statistic department and the large repository of ILO microdata based on labor force surveys, and also the work that other departments undertake at the ILO in terms of labor market indicators. Jerome mentioned about the wage data and labor market. So these are something that is built on huge efforts of harmonization, data collection, digging on making sure that countries, report, and also technical assistance on the methodology and the compilation of this data. So that's something that, and as I mentioned, 180 variables that are already embedded in the tool. One of the challenges has also been to translate this in something that is accessible online. So we're also been working with our infotech department, because it has been for the first time we had the challenge to translate such a complex data set with these variables that we are presenting and all this functionality that look nice and practical, but involve a lot of also in innovative work from the technological side. So this interface of the data and the technology is also very important. And I imagine this is something that Myra and her team have been facing. Thanks.
Great, thank you, Laura. And it, sort of both from, I think, Marisa, your comment, Laura's comments. I mean, from Marisa, your comment, sort of, you go to one of the basic fundamentals of why we put together this Women's Economic Empowerment Measurement Collaborative is the data really drives, when you have the right data, policymakers can see what they're doing or not doing, where services are being provided and not provided, and they're making, it's so basic, but it's so important. And I think in terms of Laura and Jerome, sort of the need to harmonize databases, and I think that has been a principle that has driven really our collaboration between CDD and Data2X in this measurement collaborative, that the more we harmonize data, sort of the more we gain in terms of using the data. I have a very specific question for Marisa that I want to share, and it's from a former beloved colleague of mine, Claudia Pires. And Claudia asks you, Marisa, if you have thought about how to differentiate between a demographic measure of demand for care versus ones that takes into account preferences. Marisa.
Thank you. Excellent question. We have thought about that, but we do not have the data to answer that question. But it's really good that you pose us, because we are, as I mentioned before, we are starting a process of producing more data. Data that comes from censuses, as we are conducting right now with these residencies for older people, but also with new surveys. Currently, in the city of Buenos Aires, thanks to the support of the IDB, we are conducting the new survey, a gender and generation survey, that takes into account some sort of preferences, not for every single aspect of care, but with that survey, we will be able to factor in these sort of questions. And as we are an office that produces data, we will be thinking of new ways of asking and taking into account the preferences of people on how they would like to be cared.
Thank you. Thank you so much. We are actually on time, and we could continue. I could continue asking many questions, but I just want to thank you, the three of you, for wonderful presentations, for incredibly important work that you're doing. And I want to thank sort of the funders for funding this, because it can really lead, I think, through data to a very transformative process. I mean, if we go back to the pandemic, of all the terrible things that have happened to the pandemic, but if this comes out as something, and really policymakers start really focusing on providing the right care services, I think that it can be transformative. Anyway, thank you so much to everybody. I just want to let the people who joined the WEEE Measurement Collaborative that in future meetings, probably we're going to have one of them. The next one will be to highlight the new data portal of the IMF on gender. So look, we look forward to receiving an invitation from us to the next meeting, and thank you so much for everybody, and on behalf of Data2X and CGD. Goodbye.